Michelle Kowecki, and I am one of our acupuncturists and a health coach at the Center for Health and Wellness in East Orange, New Jersey at the VA campus. This is my colleague.
Hi, I am Jutta Gassner. I'm also an acupuncturist and I'm also teaching coaching. And we're having the great pleasure today to teach you how we deliver acupressure in a telehealth setting.
So this is what you should expect from our talk today. We have set 2 goals for this talk. The first is we hope you are comfortable and confident in teaching acupressure to our veterans.
And we really want you to know that acupressure will help our veterans.
So let's get started.
Well, first thing, be sure that your environment is clutter-free, that you have a professional setting, that you look professional, and that there is no ambient noise.
And the second thing is you want to make sure you determine what the veteran needs help with, and based on this information, you determine a set of acupressure points to use, but please make sure you consider possible limitations that the veteran has reaching some of these points.
Perfect. Now we can share with you which points seem to be most oftenly used in a telehealth setting based on our experience over the last couple of weeks.
And please note, while you're teaching these points, you can teach on yourself, you can use a model, or you can also share your screen and pull up a picture of the point, which has been helpful, all 3 cases.
All right, let's get started with our 2 sets of opening points, which are either large intestine 4 and liver 3, if you have generalized pain, or Sanjiao 5 and gallbladder 40, if the pain is mostly on the outside of your body.
And for neck pain, you can choose gallbladder 20 and gallbladder 21.
And sometimes we're going to add REN 10 and kidney 17, depending on where the neck pain might be.
So Jutta,
Yes.
maybe could you explain how you teach REN 10 and kidney 17 to our veterans?
Very good question. Thank you, Michelle. So I happen to like my little friend here. I have a doll at home. And what I teach the veteran is REN 17 and kidney 10 are found on the belly. So have the veteran locate the belly button first. Put one finger on the belly button. With your other hand, go to the belly button and slightly palpate up on the belly till you hit the sternum. Then you take another finger, the middle finger or the ring finger, and you go in between those points. Now we want to go in between those 2 points, which is REN 10. Okay? So here's the location of REN 10. And kidney 17 is right adjacent. Now, if the veteran has neck pain on the right side, we'll ask the veteran to press that point with the right index finger. And the reason being, when he presses that point with the right finger, we cover REN 10 and kidney 17 on the right side. If the pain is on the left side, guess what? We're using the left index finger. We'll place it on the belly button, and we just have the veteran push down. That way, both points getting attention. Does that make sense, Michelle?
Yes, Jutta,
Okay.
thank you.
You're welcome.
So for low back pain, please consider bladder 57, bladder 40, bladder 23, bladder 10, and kidney 3.
Now, on that note, Michelle, would you be able to demonstrate how you teach kidney 23?
Sure, or bladder 23.
Oh, I'm sorry, yes.
Bladder 23, I can help you teach. Kidney 23, I'm thinking, where is that? No, I'm just kidding. So, low back pain, bladder 23. You can have the veteran place their hands on their hips and then bring their thumbs close to their spine, and then move the thumbs out to the first ridge of muscle, so about 2 inches from the spine. And approximately where their thumbs are resting is where bladder 23 is.
Thank you.
Thank you.
Now, oftentimes veterans tend to have issues with leg cramping and weakness in the lower extremities. So a point stomach 36 is oftentimes used. Now, that can be tricky to be located, and the way we tend to teach it is either on the model again or on yourself. I like the model, and I'll tell the veteran, take 3 fingers, put them together right below your knee, and see where the ring finger lands. Just literally come off the bone. And that's where the veteran would find stomach 33.
So for joint pain, you may consider spleen 9, and I'll show on the model too. Spleen 9 is found right here, so they can follow their finger up the inside of the lower leg to approximately where they hit the inside of where the knee starts, and that is where spleen 9 is.
And if you don't mind me adding, oftentimes I'll tell the veteran, if you take your right hand and you want to locate spleen 9, just move that hand over your kneecap and let that thumb naturally fall into spleen 9. And the point will hurt. So that's another good indication.
Great, thank you. So muscle pain, spleen 6, can be found approximately 4 fingers up from the tip of the
Malleolus.
The malleolus, yeah, your ankle bone there, and your finger should fall into a hole. So that is a great point for muscle pain.
Another important point is gallbladder 34. And as we know, it's the master point to loosen up our tendons, and when veterans are very tight, that's important. And we can also incorporate it for hip pain. And the way we can easily teach that is also on the model. And we can say, bend your knee, take your hand, I know this is an interesting bend, take your hand, go beyond the knee. On the outside you will feel a bump, and that's really the head of the fibula. And right below that bump, that head of that bone, is GB34. Oftentimes when you press that, you can sense almost like a little bit of an electricity, and then you know you're right on the spine.
Thank you. Another point you can choose to do is gallbladder 39, which can help with equilibrium issues and also headaches. And you can find that approximately 4 fingers up. So it's actually on the other side of spleen 6, but 4 fingers up from the outside of the ankle, right on the lateral side of the lower leg.
Okay. And our last segment of acupressure points in the telehealth environment really pertain to a big area of anxiety and being nervous. And we have a couple of 4 points that we think has worked very well for us. And that's pericardium 6, heart 7, yin tang, and massaging your earlobe. So I don't know, which one do you want to demonstrate?
You choose.
Let's do PC6.
Okay.
Okay.
Oh, I thought you meant...
To teach PC6, pericardium 6. It's a very important point, and a master point for many issues. The way I tend to teach it to the veterans is you make a fist and you flex your wrist. By doing that, you see the 2 tendons, the semimembranosus and tendinosus, pop out. All right? And PC6 is about 2 inches away from the wrist, in between those tendons. And that's where you apply pressure. I would also mention to the patients that oftentimes motion sickness bracelets are placed on that same spot, and they oftentimes have familiarity with a motion sickness bracelet.
Yes, and so heart 7 is another one you can use for anxiety, and that is found just to the inside of the tendon, right at the wrist crease on the medial side.
And yin tang is right between the eyebrows, and I'm not touching the face, but I'm touching the doll, right between the eyebrows. Okay, and that's a wonderful point for a veteran to relax, especially in the evening time, because that point brings more melatonin into your blood. So putting the focus on that is wonderful.
And lastly, you can also encourage them to massage their earlobes to help with relaxation and those endorphins.
And I always get a question, I don't know about you, Michelle, but massaging the earlobes, veterans oftentimes giggle, but then I ask them, hey, do you have pets?
Yeah.
And when they say yes, I'm like, do you ever massage their ears? And then they say what?
They do, especially dogs.
Yes. And then what is their response?
They're relaxed.
Humans are the same.
Yeah.
Well, I guess that concludes our presentation. I hope you learned and enjoyed, and best of luck.
Thank you so much for joining us.
Ciao.
Bye.